Perfect. Thanks so much for joining us. Okay. Cool. So welcome everybody. Thanks for joining us. Of course, we're going to be talking about potty training tonight. We'll be going through just a brief anatomy, just so of course we can understand the process, an overview of potty training, what are the necessities required, some ideas and recommendations that can work, briefly be talking about nighttime potty training, talking about nappy-only poopers, some information on constipation, which can occur frequently when potty training, some useful links, and then just the references used in these slides. So with anatomy, just a brief overview of the urinary system. Its job is to filter the blood, and it creates the urine from all the waste products from the liquid. It includes the kidneys, the renal pelvis, ureters, bladder, and urethra. It's under sympathetic and parasympathetic control. So basically the nervous system in our brain will let us know when we need to wee. It's complex, and the child really needs to understand what's happening to their body in order to be able to let go of those wees. The digestive system, it involves, of course, from our mouth, the food goes down into our stomach and then goes into our intestines, and then finally onto the colon into the rectum. It's for digestion, absorption of nutrients, excretion of products to the rectum, and also for protection. We have a pelvic floor, which is your muscles, that's attached to the pubic bone in the front and the tailbone at the back, and to the pelvic side walls. It's for making sure that we stay continent. It allows us to empty our rectum and our bladder. It supports our organs. As you can see, it's holding up those organs for sexual pleasure and functions, and it's really important part of our core control and our strength. And then we have the rectum. It's made up of muscle walls that are able to expand to hold that fecal matter. We, of course, don't want too much expansion, which can happen in constipation. You're wanting it to be a sensory organ that can sense that that rectum is full, and therefore get into the process of excreting the product. So the expansion of the rectum should trigger nerves in the area to send signals up to the brain that you need to have a bowel movement. The muscles in and around that anal canal then control the action. Adults and older children are able to control these muscles, relaxing them when they need to and contracting them when they decide that they don't want a bowel movement. So just to briefly speak about the process needed for a child to have a bowel movement, so you can see how complicated and how much understanding the children need to have in order to do it. Your internal sphincter will relax. The child will therefore be able to choose if they just need to fart, do they need to poo, what's going on in their rectum and the anus, and they can choose to go to the toilet or wait. If they choose not to go to the toilet, that pelvic floor and external sphincter contract, and they don't go to the toilet. But if they choose to go to the toilet, they first need to find a toilet. They have to assume the correct position, relax their pelvic floor, increase that interrectal pressure until they feel like they've emptied out. And then once they've finished, that abdominal pressure decreases, the postural reflex in the abdominal wall is reactivated, and the puborectalis muscle, basically holds everything back together, and it all returns back to normal. That anal canal closes, the child wipes, dresses, and flushes. So as you can see, this is quite a intricate process that is happening in their body. And for these little ones that we're trying to potty train, it can be quite anxiety provoking. It can be quite stressful, because suddenly their body is doing these things that don't just happen in a nappy, but rather they have to understand what's going on and make decisions. So normal frequencies, a child starts, pooing less and less and less as they start entering into toddlerhood. It's similar to an adult by 4 years old, and we are wanting them to be pooing daily. That's healthy, and that's the latest research shows it should be a daily bowel movement. For the bladder, they're normally going 4 to 7 times a day, and by the age of 5, you're wanting a child to be continent by both day and night, by increasing that bladder volumes and them being able to hold more. So if we're going into potty training, the overview, the research shows that the initiation of potty training before 24 months and later than 3 years was associated with not being able to wee properly, and also associated with constipation. Children potty trained before the age of 2 had triple the risk of developing constipation and daytime basically wetting compared to those trained between the ages of 2 and 3%. So we're wanting that child after the age of 2, pretty much just before the age of 3, in order for the best results possible and avoiding any complications. At that age, of course, that child has a better understanding of what's going on with their body and what they are required to do with the process. Signs of readiness for toilet training. They should be able to walk, put on and remove their clothing. We're wanting that expressive language and their ability to follow parental instruction. It can also be nonverbal. It doesn't have to be verbal. They need to have awareness of a full bladder or rectum and demonstrate some sort of, not enjoying the fact that they've weed or pooed in their diaper. We want them to be imitating that toilet behavior, expressing a desire to go to the toilet. For all you moms, you definitely have had your kids come into the toilet and wanting to see everything that's going on. And they need to demonstrate some sort of bladder or bowel control. So staying dry throughout a nap or starting to show that they're dry throughout the night. The biggest thing for you guys as parents or even as school teachers or whoever we've got here, it's that you need to be counseled that no training method is superior to another. It's all child specific. You want to choose the one that's going to be best suited to your child and your child the best. We do, though, encourage positive reinforcement. So no, they mustn't get disciplined. It's not a bad process. We're wanting all that positive reinforcement to come in. Complications can include toilet refusal, withholding their poos, hiding, wetting themselves, pooing themselves, having those accidents. Most of these will resolve in time, and we do see that children that have more accidents while toilet training can often have more effective toilet training because they know what not to do or understand their bodies when it goes wrong. Medical comorbidities such as Down syndrome, autism, and cerebral palsy reduce the likelihood of successfully toilet training. And this is where you would definitely need to come and see an occupational therapist, sometimes a psychologist. We want those pediatricians involved so that we can work as a team to best help your child with what they're needing. If you do have a child with any of those diagnoses or others, please do contact us. But I hope this is still beneficial. So Dr. Hodges is a guru in potty training and bedwetting and all the rest. And his rules for potty training are definitely watching signs for any constipation. Don't start training your child if they've had a history of constipation, waiting until they're having those really, really soft poos, and making sure the school also reports the same. You need to wait until your child is ready, not when you or your preschool are ready. So I know a lot of schools do require that the child is potty trained before attending school, and sometimes this can cause problems. Your child should be dressing and undressing without help, showing interest in the toilet, noticing when they have that dirty diaper, and telling you they need to pee or poo. You're wanting your child to lead the way. So we don't, as I said before, no punishment or disappointment. We're wanting that positive reinforcement. We want them to let us know, that the toilet, you use the toilet when your body tells you it's time, rather than, it's really important that your nappy or, your underpants and stuff are dry by the end of the day. Once again, doing that open door policy, telling them, especially, I've got the feeling, my bum told me that I need to poo, or I feel like I need to go wee, so I am going to go wee. We want that. We just want that as part of the discussion. We're wanting to explain to them why it's important to poo daily and pee often, and that everyone poos. You can go through a conversation, they can list people and you can be like, they poo too, and they poo too. Just making it not a taboo subject and making it really, really welcome to converse with them. We want the child to recognize and act on that urge to pee and poo. Withholding behaviors can be that little crotch grabbing, dance, squirming, toe walking, curtsying, squeezing their legs together, doing whatever they can to keep that inside, and just helping them know that you can see those behaviors and the reason why they're doing those behaviors, and explain to them a little bit more. Point out where the toilet is, especially when you're out, making sure that they are aware that there's always a toilet available, and we're not carry that toilet with you, or the potty, so that they have access to something that they feel comfortable on. Keeping a potty in the car, we're wanting to prompt them to pee every 2 hours and try poo after breakfast and dinner, because when food goes in, it's a lot easier for something to come out at the end. Establishing a pee schedule. So often at school, just asking the school, can you prompt every 2 hours? Not saying, do you need to go to the toilet, but rather saying it's time to go. We want them relaxing on the toilet and making sure to let it all out. So a lot of kids at the beginning of potty training will do a little bit of a wee, get so excited and then want to leave. So we're wanting them to be encouraged to stay on the toilet, and we will speak further about this. Boys must learn how to sit and wee. So it can kind of ruin the positioning for actually pooing, and it can cause some issues. We're wanting them to relax by sitting down and weeing. Later on, they can learn how to stand and wee. That's not a problem, but when they're first learning, they should be sitting. Girls must have legs apart. We don't want that urine pooling in the vagina. It can cause UTIs, especially if they start becoming constipated. And they're never blaming or shaming for their accidents. If they are still having accidents, you can go to a pediatrician and do further investigation, or maybe try again at a later stage. And don't ever stop asking your children when they poo, making sure that they're giving you, feedback when they get back to school, and making it a fun little thing, like, how was your poo today? Also, if you need to, letting your school know that, could they please keep tabs? What does the poo look like? Is it nice and soft, or is it like hard, like little rabbit pellets? And we're always wanting to provide that high stool for their feet. So things go wrong because wees are usually easiest to master, and then the child stays in that nappy for pooing. We find that they then withhold until they get that nappy on. They become a nappy only pooper, and they avoid going to the toilets. Boys who stand to wee, and they also tend to try stand and poo, and that's difficult to transition, as well as it makes it really hard for that poo to come out. If the child is not ready after 7 to 14 days or lost interest, parents normally try push on, because they're like, no, we prepared for this, let's do this, but rather, going back to the nappies for a little bit. And as we spoke about, sometimes schools can rush this potty training. Okay, so the biggest thing is never compare your potty training journey to someone else's. I know I'm a mom myself, and it's often, we've got this book, or we've done it this way, or why has your child not been potty trained? And I think it's just important as you as moms and dads to have that instinct of when is the right time, and not trying to rush this process. So necessities for potty training. One of the biggest things that you can do from the time a baby is young is talk about their anatomy, what is happening with their body, start getting books. I've got a few here, which we'll speak about. How do you poo? Once upon a potty. You can get diagram pictures and books, just letting them know kind of what's happening with their body. We want positive associations with poo. It has shown to shorten the time it actually takes to potty train. We're wanting them to come into the bathroom with you in order to see what happens, getting them used to that environment, because it's quite a lot sensory wise. We want to be talking about the color, smell, and size. So when they're doing a poo, even if it's in their nappy, looking at it, is it big, is it little? I know often when kids eat corn, the corn is still in their nappy the next day. So just getting them used to it, and not making it a taboo subject. We're wanting that nappy off time for a few weeks. I mean, even from a baby, you can do it. So they get used to those sensations, because disposable diapers are so absorbent these days that it's really hard for the child to know what's actually going on, because they can't feel anything. And then we're wanting to get a potty earlier before you're ready to start, and have it visible to introduce it and explain what it is for. There. So potty wise, we want, you get various shapes and sizes. I find it's very beneficial to have a few options for your child to choose. Some kids, for me, I would recommend starting in the floor potty. It's a lot easier to get their positioning right. But if you want to go straight to a toilet, it is easier later on for the transition from potty to toilet. You kind of miss that step. But it's so important that they are able to rest their feet while they are seated. We are also wanting to decrease that toiletty diameter. So if you are going to use a big toilet, making sure you have a seat on top, because the last thing we want is them to grip on the sides and grip their whole body, and trying to release poo or wee is really hard if they are doing that. And we don't want any difficulty with that experience. Position is in the, just as a little activity, if any of you are sitting, I want you to, if you are sitting on a chair, hold the side of the chair, lifting your feet, and try engage your tummy muscles to keep your feet lifted. And you can feel that you wouldn't be able to push out anything. It's not a relaxing position at all. So if you look at the picture, we're wanting more squat position. The rectal angle is more beneficial for that poo to actually slide out. So you are helping them. And that's why a floor potty is really nice, because their knees are normally higher than their bum, and you're just wanting them to lean a little bit forward. Toilets are getting higher to aid those adults that can't stand up or sit down, but unfortunately this makes it really difficult for our kids. So please, have a stool. It's really beneficial to get a stool that you can take around with you. So if you're going to another toilet, you'll be able to take it with you as well. Breathing and blowing is really important. So we're wanting them to breathe in. If you guys want to do it with me, breathe in, making your belly big, breathe out, tighten those tummy muscles as you push to poo. So this allows our pressure inside our tummy to increase. It, of course, bulges everything downwards. The anus opens and allows it to come out easier. There are things like balloon breath. So pretending like we have a balloon. We think about breathing in, filling that balloon with your tummy with your hands as it fills up with air. Keep breathing in until your balloon is as full as it can be. Now breathe out slowly and feel your balloon emptying. Keep breathing out until all the air is out of your balloon. And these kind of things are really great to teach our kids, and can be done not even on the toilet, but getting them used to that. And then cow breathing, so doing that moo sound, moo, on the toilet can help. And then also blowing bubbles while on the toilet can really be a good way of teaching them. Movement of the body in turn help movement of a poo. So if your child isn't active during the day, you'll find that they'll have a little bit more difficulty getting that poo out. So some activities like jumping on a trampoline, there's different yoga poses. It's so important because the child needs to have sufficient postural control and core strength to be able to sit in the position on the toilet as well as push out a poo. So you can also play games in the squatting position. Just getting them used to that position will really help them be able to poo. Sensory wise, the toilet can be really scary. It's normally, whitewashed walls. It's quite cold because it's normally tiled. A lot of kids, if they're pooing on the toilet, the poo drops and plops, and then suddenly they've got water on their bum. So it's quite a scary place. So we're wanting to desensitize that as much as possible. And that can be done by getting that child into the bathroom with you before the pressure's on them. We're also wanting to improve that body awareness and interoception. So that's known as the eighth sense of our body. And it's just that inner sense of knowing what's needed to happen or what we need. We're wanting to reduce that unpleasant stimuli as much as possible. So if you can put down like a nice mat for them, or make it less scary. Of course, us as occupational therapists, always work with sensory systems. So if you have any further questions, of course, you're welcome to ask. I have a special kit of things that they can play with. So I have a picture there of, some things that could be included in their kits. Something like this where they're literally playing with what looks like a poo, and they can squish it and feel it. You can have the bubbles there for them. You can have, a really nice soft toy that they might be able to play with. All these kind of things allow them and encourage them to spend more time on the toilet. I mean, it doesn't have to be a poo book. It can be another type of book, a story that really interests them. What I would recommend though is this basket. You tell them that it's only for toilet time. So it's a special toilet time basket. If they are wanting to get off the toilet and the time's done, just allowing them an extra 5 minutes to play with it, but leaving it in that bathroom situation. Hydration and diet. Of course, there are dietitians. There's great dietitians on the island. If you're needing those contact details, please contact me. But just for a brief overview, we're wanting them to have extra liquids. So the more liquid they have, of course, the more output they'll have. So it's a lot easier to get them to wee on those 2-hour marks if they're getting their consumption of liquid correct. So of course, the best is water, but if you're needing something to motivate them a little bit, adding a little bit of fruit juice, 100% fruit juice to that, watermelon, oranges, Jello, ice pops, all of those are really great ideas and can be also used as rewards. If they are a little bit, having a problem with that constipation, you can also add prune juice. Foods that are really good, all those dried fruits, pear, apple, prunes. We're also wanting to increase their fiber while they're learning. Reward. So in the beginning, rewarding all outcomes, starting to really, make a big deal about even if the fact that they're pooing in their nappy, so that they start realizing that it's a good thing that they're excreting from their body. Doing it a reward, even if they aren't on the potty. So rewarding the efforts, not the dryness, expect accidents, always applauding the poo, no dirty messages, and then eventually rewarding for anything on the potty. Clothing, important that they are able to remove their clothing by themselves, always putting them in comfortable clothing, especially for school. And letting them have a choice of what underwear they want. So what we're wanting is no clothes, then moving on to loose underwear, then moving on to tight underwear, then loose clothing, and then just their normal clothing. And this is normally done, if you're potty training over a week or 2-week period. Time, just understanding that it's a developmental process and not a race. Making sure you have time when you do decide to do it on a long weekend, holidays, because normally, it can take a child up to 2 weeks to come to terms with. And if you are moving them into a school situation, it can increase that anxiety. And also taking your child every 2 to 3 hours. Remember to not ask, do you need to go, but rather say, let's go sit on the potty. And then wiping. Wiping is normally a developmental milestone that they won't achieve when potty training, but I just thought I'd add it in so that you guys can have some cool tips and tricks when you do decide to start introducing it. You can introduce it right from the beginning, but often they are a little bit too young and won't always get it perfect. So you can practice on their potty buddy, which we'll speak about, a teddy or someone that they are themselves educating and teaching and teaching them how to go potty. They can also practice on themselves when they're in the bath, using a cloth, using peanut butter on balloons tied around a chair, as you can see in the picture, and practicing there with the toilet paper, using flushable wipes to make sure that they are able to wipe, and performing wipe checks. So ideas and recommendations. A sticker chart. So all participants will be sending through a potty training support pack just with some cool ideas. The potty reward charts down on the bottom right will be included, as well as a mermaid themed one. So sticker charts are great because they are non-edible. They're just easier to give a child. You can also use a stamp. I've recently potty trained my child, and we used a small sticker for a wee and a big sticker for a poo. And it was really cool because when he was done potty training, he was pointing out where all the poos were and really proud of the fact that it's a bigger thing to get. And yeah, just get a theme that your child enjoys. So if they're boy, dinosaurs, construction vehicles, things like that, that they'll really feel motivated. And they also feel like they are part of the potty training because they can choose what sticker they want and they can, reward themselves. It's also nice then at the end of every row to give them a small prize. so that they've achieved something. Things like, you know, a little bit of slime or whatever. It doesn't have to be big. A timer. So of course, we're wanting to encourage your child to sit on the toilet, and also to not just sit, let out a little bit of a wee, get up and go. We're wanting to encourage them to let it all out. So timers are really great. So you can use an egg timer like the cow and just set it to around 5 minutes, or get a sand timer, something that can stay in the bathroom. And when they do go, you know, using it to show them to sit for longer, just make sure that everything's out. New underwear. So often, you know, trading in those nappies for underwear, and getting something they're really excited about. So of course, whatever thing they're currently in, whether it's dinosaurs, unicorns, kitty cats, whatever they're excited, it can get them to be really excited to give up those nappies. And also they get to choose a new pair. So yes, if there's an accident, then they can go choose a new pair, and it really helps involve them more in the process. Books, as I showed you before, poo books. The one at the bottom right is a really nice interactive flat book that shows what goes on in their body. It's also really nice because it's not just about digestion, it shows them their whole body. It's a really good book, because all we're wanting to do is make everything less taboo. We want it, you know, to be an easy conversation between parent and child, using terminology and things that they are more comfortable with talking. And then just a on-the-go potty training list. So some kids don't need these, but it's better to be prepared. Like with this whole thing, I would say be prepared as much as you can when potty training, because it is a stressful situation, and you do need as much support and education as possible. So having that potty in your car or foldable potty training seat is really beneficial to take away that anxiety of them using another toilet. You know, also making them aware, say you're going to Kamana Bay, telling them where the toilets are in Kamana Bay, or while they're playing in the fountains, be like, don't worry, the toilet's right over there. Just helps them know where they need to go, when they need to go. Having changes of clothes, both for child and mom. So of course, if they're having an accident, you're definitely going to want a change of clothes for yourself as well. Having a wet bag to chuck all those accident clothes in. Wipes to, of course, clean your child. Taking some of those potty rewards with you. So if you are using stickers, you could change it up and have a sweet or something to take with you. Having an absorbent cloth makes cleanup easy, especially if you're in the aisle at Foster's or Kirk's or wherever you are, just to quickly wipe the floor if needed, and make it less of an embarrassment. And then something that you could also use is sticky notes, because often the new toilets these days have an automatic flush, and you're wanting to cover that so that in the middle of your child sitting on the toilet, they're not getting water splashing on their bum. Other ideas to help encourage is a drop of blue food coloring in their potty so that it changes color when they wee. It'll change to green. It's quite exciting for a child. And then, as I mentioned before, having a potty buddy. So that could be a teddy, a doll, or animal, and they can practice the whole process as preparation. They can have them sitting maybe on the big toilet if they're on the potty, or vice versa. And it's this whole buddy that they can go through the potty training process with. Nighttime potty training. So it is recommended that you can do day and nighttime potty training at the same time. Makes it really clear to the child that nappies are gone and they're no longer there. It also stops the child from withholding, as I said, to poo until their night nappy is on. If you are going to do that, you're wanting to reduce fluids before bedtime. You want them to wee at the start of their bedtime routine. So if they're going to go have a shower or bath, they can do it in the shower, or just before. And then again, just before they're about to go to sleep, encouraging them to go do that wee. Also making sure to leave the potty in the same place in their room every night. And when you are going to do that, practicing with them to, pretend that they're sleeping. Then you tickle their tummy and say, you need a wee, where are you going to go? And practicing them getting off that bed. If they are in a crib, they could call you and still go to that same place in their room every night. And then a nice tip and trick is layering their bedding. So having a waterproof fitted sheets with your fitted sheet over, waterproof fitted sheets, so that nighttime changes are really quick and easy, as well as having their pajamas next So if you do have an accident, it's just taking off that one layer and then laying them down to sleep again. So talking about nappy only poopers, which as you've heard are really normal, and this is how you can try help them. So of course this is very frustrating for parents, embarrassing for children and parents. These children are often frequently constipated because they have this withholding, that they are only going in their nappy. So often they've got the wheeze in the toilet, so they're in their underwear, but they're only going to poo in their nappy. So this normally they start pooing just at lunchtime when they get their nap or at night. It's usually associated with previous constipation. So if they've had a really painful bowel movement on the toilet or even in their nappy, it can make them avoid to poo on the toilet. It also can be associated with sensory processing disorders. Once again, this is when you'll have to get somebody involved, a medical professional like an occupational therapist. It can affect the relationship between child and parent because everything becomes an event rather than just kind of smooth transition or going when they need to go. And it can cause this fear and anxiety both in parent, child, and everyone involved in the situation. So how you could transition them to the toilet, they really need to be doing a soft poo daily. It can't be treated, while they're constipated. So if you need to go into the pediatrician to see if there's any other kind of medicinal things that you could use, like laxatives, enemas, those kind of things, or looking at their diet and seeing if you can make changes with that, going to a dietitian. Always allowing that nappy though when they need to poo. We don't want them withholding. So it's that you want them to not poo in their nappy, but you also don't want them to not poo. So giving them that nappy when they're needing it, to avoid constipation. You want to educate your child how the poos want to go potty in the toilet. So, always, even if they aren't pooing in their nappy, dropping that poo into the toilet. You can even add confetti or glitter and make it like a potty. The Poo's Gone to Poo Land. I'll mention it later, but there is a Poo Land app. And, reading a book about explaining poo wanting to go into the toilet. Getting them to always poo in that squat position. So, if they're doing the whole hiding behind the curtain in a room, at least getting them to squat in that position. But we are wanting to, as much as we can, getting them into that toilet situation rather than pooing somewhere else. And once again, encouraging them to blow while pooing, using balloons, bubbles, anything like that. Encouraging those boys to sit to wee and rewarding the action at every stage. I'll show you the transition in the next slide, but rewarding at every stage, giving that treat straight away on the toilet. And then affirmations work really well for a child at night. I am brave, I am strong, I am kind, and soon I will be doing all my poos in the toilet like the big boy or girl I am. So transitioning them from the nappy to the toilet, we're wanting them pooping with their nappy on in the bathroom and rewarding them when they do that. None of this hiding behavior. They're welcome to privacy, close the door if they require that, but not pooing in mom and dad's room, their room, behind the curtain, anywhere like that. Then we want them sitting on the toilet with the nappy on for 2 minutes, blowing before getting off to poo. So, sitting, blowing, they might poo in their nappy, and that's incredible if it's on the toilet, but if they get off and then poo afterwards, still rewarding that. And then encouraging them to poo on the toilet with the nappy on. Of course, making sure their feet are nicely planted and the positioning is correct. And then starting to do one fasten of the nappy, then both fastens of the nappy, so it's kind of loosely on. And then you can cut a hole in the nappy and then remove the nappy when the child is happy. This, of course, can be a lengthy process. Some children get it after a few weeks. And then I wanted to briefly speak about constipation, because the whole way through, I've highlighted the fact that your child can become constipated. And I just wanted to give some education on what constipation is, so that you know what to expect, be avoidant of. So constipation, between 10 and 20% of children are constipated. The peak incidence is when the children are getting potty trained because of this withholding behavior or only wanting to poo in their nappy. Functional constipation causes 95% of constipation in children, the others due to other circumstances. And the majority of functional constipation is in childhood. It can be associated with low urinary tract system symptoms and fecal incontinence. There's many causes: illness, school change, not being able to access toilets, change in routine, painful experiences, anything like that can cause functional constipation. How it's caused: the child gets dehydrated or withholds because of that change in routine, school caregiver, or they're learning how to poo and they don't like using the toilets. That poo then stays in the rectum, which is that sensory organ, for a long period of time. The more longer it stays in there, the more fluid gets reabsorbed and that poo gets harder. Then the child decides, they have to poo, their tummy is sore, they know they need to go, or, they put in the position and they'd go. And then that poo is hard and it hurts, and it can even cause an anal fissure, which is basically a small cut by the anus that can be really painful. And then the next time they need to go, they remember that previous unpleasant experience. They decide they don't want to experience that again. They hold onto it. The stool piles up in the rectum, which can become stretched. That rectal diameter increases. And that organ, which was previously a sensory organ telling them when they needed to poo, now becomes a storage organ. They lose that urge to go to the toilet, and it causes the cycle to continue. And then what starts to happen is, rather than them feeling in their rectum that they need to go poo, they only feel it later on. And that's when they're getting that tummy pain rather than feeling it down below. And this just makes the problem worse. And it's really hard once in the cycle to get out of it without, further help from a pediatrician or others. So signs to look out for: that your child might be constipated, poos that look like rabbit droppings or balls, very wide poos, very loose poo accidents, so having a lot of skid marks, itchy bum, them having to use too much toilet paper, them needing to push too hard for the poo, not enough poo, so little poos coming out, getting tummy aches, getting bedwetting and accidents, because as you can imagine, if that rectum is stretched out with poo, it's putting a lot of pressure on that bladder, and that's often when you see accidents. Having problems with toilet training, for girls especially, getting recurrent UTIs, and then them needing lots of wees close together, because once again, rectum full, putting pressure on the bladder, so then they go to the toilet often to let out little bits of wee rather than fully letting go. So this is also included in the parent support pack that you guys will be getting, just to have a nice visual to show your kids, what is healthy poo. That's your mushy snake. It looks like soft serve ice cream. And then also making them aware that getting rabbit pellets or a big log coming out or thick and bumpy is not actually a good thing. Useful links and resources. Dr. Hodges' website, bedwettingandaccidents.com, is really good. It's got some lovely infographics, especially if there's any teachers listening in. It's got some really nice ones for school and how to help assist parents at school with potty training. We've got the Poo Goes Home to Pooland app, really simply designed, but kids absolutely love it and really interactive. The Potty Training Consultant on Instagram has some really nice infographics, and she's just got some really nice ways of thinking about potty training. And there's just my references. So yes, thank you. That's my email address if you're wanting to take it down. If you have any questions, I am available for consultations. So if you know that your child is possibly constipated, if you're needing some assistance with potty training, how to set up, talk about what you think would be most beneficial for your child, you're welcome to contact me. And if you're wanting to use this presentation for anything or any slides or information, just please access us and you can chat further with us. I'm going to open it up now to questions. If anyone has anything that they would like to ask me, you can write it on the chat, or you're welcome to unmute yourself and ask me a question.
Hi. I have a question. You talk about the pooping, the diaper poopers, yes?
Yes.
But what if like I'm a teacher, so I feel a lot of the children not necessarily are diaper poopers, but yes, constipated,
Yeah.
definitely, we see that. But a lot of what I see in the field is children are more successful with using the bathroom, what the potty, without underwear. As soon as the underwear goes on, there is that safety net,
Yeah.
and I'm just not quite sure, because obviously once the children leave my class, they're gonna go somewhere else where where this is not or where this should not happen anymore. So how can I help the child and the parents to break that cycle?
I think you would do it. So you're saying that they're wanting to poo in their underwear rather
So yeah,
than
exactly.
going on the
But
toilet.
exactly, and if
Okay.
there's no underwear, they go to the toilet.
Okay. So it's basically that they're just requiring something to catch the poo or the wee that comes out.
Exactly, and then they come to us and tell us, "Oh, I did it." Like they're aware of it.
Yeah.
Yes.
So I think, Michelle, as a kind of, rather to preempt that possibly happening is getting into that routine. And unfortunately, sometimes it is a backtrack of having to get them onto the toilet every 2 to 3 hours. And I realize at school it can be quite difficult, but maybe grouping those kids that have those difficulties and giving them more opportunities during the day to go to the toilet, so that you are preventing those things happening by rather getting them onto the toilet at the correct time, which of course, if they're on the toilet, they will be without their underwear. So encouraging them and reiterating the fact that those things happen on the toilet. Does that help?
Yeah, like yes and no. It's just like, no, I definitely gonna try it. We do have quite a regular schedule when we tell them to go. It's just, it feels like once prompted, it doesn't necessarily happen. But I like the timer, and I think this is something I'm trying in school with the timer, to have those children who are known for just with that timer.
Awesome. Michelle, I'd also love to chat to you further. Please do email me. I don't mind
Thank you so much.
coming to see the school or further discussing this and seeing how I can help you.
Oh yeah, maybe you could help us with a little setup or something.
Yes, definitely. Please do send me an email.
Thank you very much for putting this seminar on. I loved it. Thanks.
Absolute pleasure, Michelle. I've got 2 questions that have come through on the chat. The one question, is there a best age to start? Yes, definitely. We're not wanting to start before the age of 2. As mentioned, it can cause constipation and further issues because the child might not be ready to take on what a big thing this potty training is. We are wanting them to start closer to the age of 3. It has been shown for long-term benefits. So often you get a child, we've got children that come to me and it's like, oh no, they got potty training perfectly, but it can cause issues later on if they are trained before the age of 2. So the answer shortly is between the ages of 2 and 3 is beneficial, closer to the age of 3. And then the second question kind of relates to that question. That question was, is 15 months too young? I would say yes. I would say at 15 months, you can start to, taking their pants off, giving them opportunity to feel it, starting that preparation. But I wouldn't say getting into that full-blown potty training, taking their underwear away, their pull-ups away, giving them underwear, those kind of things. But at the same stage, your child might be ready. Please do email me and contact me if you're needing any help. Tips for twins. That's always great. So first of all, with twins, don't feel like they have to potty train at the same time. And I know that must put so much stress on you as a mom, because it would be so much easier to say, buy nappies, underwear. But as you all know with twins, very different personalities, very different needs. One might be advanced in one way and the other one not. So it's very important to still try to keep that individuality. When one shows signs, letting them potty train, which in turn might help the other one potty train after. I hope that helps with twins. It is kind of following the same pattern. It's just that it might be staggered in meaning that you will have to train the one before the other. I think there might be one more question. Sorry, I'm just looking at it. I did that one, yeah. My son is showing signs of readiness. He will ask to pee, but I don't think he understands when he wants to poo. How do I help him to understand the difference? So I think it comes down to, that's why I went into anatomy, because often kids don't actually understand what's going on with their body. They don't understand penis, vagina, bum, you use all those terminologies and, recite with them, especially with a boy, where does your wee come from? Your wee comes out of your penis. Where does your poo come out? Your poo comes out of your bum, so that he can start to distinguish which hole it's coming out of and the difference basically with that. And then he'll start to understand, which side he's getting that sensation out of, and hopefully will understand it better, how to understand the difference between the two. So I also have a question here. What if you have a child who loves to say no and do everything the opposite of what you suggest, even if you think they're ready? So I think that boils down to when I said to you, you don't give them the option of going to the toilet. So if you are going to decide to do the potty training, you don't give them option of going to the toilet. You say, we're going to the toilet, and you can go sit with them and let them sit down, making it fun. The whole, creating like a box might be quite a good idea for a child that wants to say no, making it all new things. Most kids love bubbles. So making it a really fun experience. So if you think that they are ready, making it the most exciting experience ever. So instead of saying no, they're way more willing and motivated to do it. It just might require you as a parent to be the external motivator rather than them having that internal motivation. But once again, if it's not working after 2 weeks, please don't try to persevere. If they are at age, you're welcome to contact me. Otherwise, try again maybe in a few months. Cool. I will just wait for another 3 minutes if anyone has any further questions. You're welcome to unmute yourself or write it in the chat. I'm so glad you guys have found this beneficial. I know it's a really hard thing to go through. It's stressful, but I think the more you can be prepared, the better your output and your experience is going to be for you and your family. The last thing I want is for this to be stressful and cause issues and become this anxious experience. With regards to getting a copy of the slides, if you just want to contact me individually or at info@kidsability.ky, I'll write the email address here in the chat. Either of those, you can contact us and request the slides. But otherwise, that support pack will be sent out to all those that attended. I do see another. Okay, I have a child who is potty trained, 6 years old, but often gets so absorbed in what he's doing that he doesn't notice he needs to go sometimes. Any advice? There watches you can get. So that can prompt the child, can be quite beneficial, especially if they're at school, to prompt them every 2 to 3 hours to go to the potty or to go to the toilet at 6 years old. And it can be a nice reminder, because often their sensory system, they're obviously not getting that sensation to alert them, and they might need an external kind of device to alert them. I know a lot of kids at schools are wearing kind of some sort of watch. So if it does have an app that you can load, or kind of a recurrent timer or something that can alert them, that can be quite beneficial to let them know. But of course, once again, sometimes it is backtracking. It's going back to the basics of potty training, even at 6 years old, and reminding them as much as you need to, for them to kind of get that body in a routine. Sorry, I just realized I only sent that email address directly to someone. So I've sent it there for everyone to get. Okay, if there are no more questions, we are going to stop the recording, and I'm going to say good night to everybody. Thanks so much for attending. If you know anyone that needs further support, or wanting to see kind of my presentation or chat to me, if you know anyone even with an older child that has issues with constipation or anything like that, please do get hold of me so that I can help. But yeah, thank you so much for your time tonight. I really appreciate you all attending. Have a lovely evening. Bye.
God bless you, darling. Thank you.
Thank you. Will you stop recording?
Thank you.
Pleasure.